you very much. Good afternoon, everybody, and welcome to this afternoon's meeting of the Employment Committee. I'm Councillor Stuart Brown, the chair of the committee, and I'd just like to say a big welcome back to members returning to the committee, and welcome for the first time for those who have not been before. Before we start, a little bit of housekeeping and safety information. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact that this meeting is being live streamed. Please use the microphones and remember to switch them off when you have finished speaking, or the camera will stay on you. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those who state explicitly that they do not wish to be recorded. So let's start with some introductions. If we go members first, starting with Councillor Ashmore.
Dave Ashmore, one of the Fratton councillors.
Peter Candlish, Eastern in Craneswater, deputising for Councillor Darren Sanders.
Councillor Charlotte Gerarda, Central Southsea.
Natasha Edmonds, Director of Corporate Services.
Rochelle Williams, Human Resources.
Jane Dodino, Local Democracy Officer.
Thank you all very much. And we also welcome Darcy, who is a work experience student observing the meeting. Welcome, Darcy. We have received apologies from Councillor Sanders, who is morphed into Councillor Candlish this afternoon. And we have tentative apologies from Councillors Bosher and Corkery, who will both do their best to attend, but may not be able to make the meeting, and we will note their apologies if they are unable to get here. So moving on to the agenda, do members have any interest they wish to declare before we get going? Councillor Gerarda.
Just that I'm a member of Unite the Union and GMB.
Thank you. Members, any other interests? I'm seeing none. Fantastic. Let's move on to Councillor Candlish.
I've just actually thought about it. My wife works for the council as a youth service person, but is currently literally off sick at the moment, and we are discussing sickness things. But I don't believe that it is.
I would consider that personal but not prejudicial, so I don't think there's any need for you to recuse yourself from that item. Moving on to item 3, minutes of the meeting held on the 4th of March. Has everyone had a chance to skim through any corrections, amendments, questions, queries, comments, or am I okay to sign off the minutes as a correct record? All agreed? Fantastic, thank you very much. Item 4, and I'm going to ask Rochelle to introduce the sickness absence biannual report, please.
Thank you. And for those of you who have attended committee before, you'll know that we missed this agenda item on the previous one, so it's a slightly delayed report due to some changing in reporting over there. So just for clarity, the reporting period of this data is from November 24 to May 25, and that data has been compared to the previous EC report, which was in June 2024. And as you'll see in the report, we've seen a slight increase in absence levels. Total working days lost for the period increased by 2,044 days, increasing the average absence per person from 9.16 in the last report to 9.65 in days per person in this report. There is some positive news in the report in terms of those directorates who have seen a slight decrease, which is the Executive, HMBS and Public Health. The increase is not unusual for the reporting period in question because we often see a spike in coughs, colds, viruses. And since the last report, we have seen an increase of 552 days for this reason. Predominantly, as you'll see in the report, is those services who are in our more face-to-face type roles where infection is obviously more prevalent. We also had a period where reporting was not as accessible as it normally is. If you don't get the reporting, it is far difficult for managers to be able to manage the attendance levels, especially where they've got large teams. And we also had a vacancy within the HR department of one of our staff who would normally use that reporting to proactively work with services. So we've had a little bit of a perfect storm in terms of the time of year and the reporting availability. So 101 people took up the employer's offer of a free flu vaccination, so that's relevant for this reporting period in question. That has declined. It continues to decline over the years. We don't get huge take-up like we did 10, 15 years ago, and we're linking that to the far better and more proactive approach of the NHS providing those to our more vulnerable citizens across the city, and people taking those up in advance of our offer becoming available, because that's just simply how the vaccinations are distributed. It goes NHS first, and then obviously employers come second to that. We're also seeing an increase in organisational change. You'll also be aware that we've got devolution started to be discussed and LGR starting to be discussed. So whilst you'll see in the report later on the measures we're taking to try and manage and support employees in the workplace, whenever you have such sort of volatile working conditions, you do often see an increase in absence levels across the organisation. So just to prepare you for future reports, we can talk about what we're doing in that space. The top reasons for absence remain unchanged to the previous reports, and our wellbeing activities, as always, are focused around those areas. So just to give you a brief update, which was requested last time in terms of our benefits platform and VivUp and how that's operating. We have 266 employees who have received, in the moment, telephone or face-to-face support from our employee assistance programme. We've had 394 employees who have received enhanced counselling in the last 12 months, so that's when they've gone on for further support. The top presenting issues for our EAP referrals are stress, anxiety, depression, low mood and bereavement. You'll be aware that we have the online GP service, which is available for all staff, and we've had 259 online GP consultations have been booked via VivUp in the past 12 months, and this is consistently an area that we get really positive feedback from staff who have perhaps struggled to gain access to their local GP, so it's a real positive area for us. From the 1st of Jan 24 to the 1st of January 25, we had 2,852 clicks onto our Your Care wellbeing platform. So this can be accessed from anywhere, personal devices, in the workplace. It's lots of information about how to manage your own wellbeing, and obviously our marketing team are able to give us all the stats as to what people are finding useful, so that can inform our decision making about what we do. In addition to that, the other wellbeing activities that have been progressed, we've launched the LGBTQ+ and bereavement staff groups. I know that's something we've spoken about in this forum before, as well as celebrating Pride Month under our Proud to Work for PCC board, which is up in the, well, it's just been taken down today because we've moved into July, but it was up for the month, where staff were able to make pledges as to how they will support that community in the workplace. So that's been a really positive message for staff, and the working group's going really well. We've hosted an employee roadshow at the civic offices to highlight the available benefits. So this is all of our VivUp benefits platform, our AVCs, our will writing service, all of our benefits in one place. Our health and wellbeing checks are still being offered to non-civic based staff, with mini wellbeing roadshows taking place throughout the city. And to date, we've had 250 staff who have received a health check, and those are all people non-civic based, because we're aware it's much easier for us to facilitate sessions here, but we do have a huge amount of our workforce who are not based in the civic and perhaps find it more difficult to access some of our services. As mentioned, our wellbeing initiatives are linked to the top reasons for absence, and mental health first aid training is still available to all employees, as well as suicide awareness training and Connect 5 training. So really focusing on making every contact count with our customers as well as our staff and who we're engaging with. Cancer awareness posters have been distributed to all PCC building toilets to remind employees how to spot the early signs of cancer, and this is a public health initiative where they've worked with us in terms of the workforce, because we make up such a large percentage of the city's residents as well, so it's a dual piece of work there. Regular lunchtime learning sessions have continued on a range of wellbeing topics, and the promotion of the wellbeing champion role has continued, and so we're still continuing to receive volunteers in that place. We still have 2 training sessions that are in place, one focusing on workplace wellbeing and another focusing on the policy side of things for managers and how to manage attendance, and they're still very popular. One's run monthly and one's run bi-monthly, so still rolling those out to staff and managers across the organisation. And that was it for me in terms of a summary, unless anyone has any specific questions.
Superb, thank you very much, Rochelle. I think it's safe to say that although we've seen a seasonal spike in days lost to sickness absence compared to the last report, it's not out of line with previous winter reporting periods. No,
it's completely in line with that time of year. It's just unfortunate we missed the previous reporting period, because we're likely to see a decline and then a slight increase, but we would hope that it would level back out for the next report.
Brilliant, thank you. Members, do you have any questions on the report? Councillor Gerarda.
Thank you for Another great report, Michelle, really appreciated. Yeah, I've just got a few questions. Would it be possible just to clarify what falls under sort of corporate services, but the types of role that those people do, if that's all right? I've got a few other questions, sorry. So. And then my other question was about how come the port in particular has obviously seen quite a significant increase. I just wondered if you had a sense of why that might be. And then if staff have the opportunity to feed in ideas about future sort of health and well-being sort of projects which will obviously help to reduce sort of illnesses and sick days. And then my very last question, on page, sorry, just find it. Oh, it's typical, I can't find what I was looking for now. There was just a listed, oh, here it is, sorry, on page 23, it lists the absence reasons and it says blank, and there's like 328 days lost, and I just wondered, what is blank? Thank you.
Natasha, do you want to come in on corporate services first?
So, yeah, if I do the first one, then I'll hand over to Rochelle for the other question. So, corporate services is made up of largely desk-based roles, not all. We do have some roles where staff, for example, security or dispatch colleagues, and some of our city help desk are more sort of front-facing, customer-facing roles, but they probably make up no more than 20%, probably less, of the directorate. The rest of the directorate tends to be desk-based and also in the civic office building. Does that help? I can give more detail. I mean, it's IT, HR, legal services, etc. So tend to be desk-based.
In terms of the easiest one first, blank is when somebody doesn't put in a reason, and we previously removed that from the system so that it wasn't optional. I'm assuming because it's upgraded that there's been a gap in time where that's been visible again, so I can go back and check with the data team already to see if we can rule that out. But sometimes it can be a bit of a lag between entering the absence, but you haven't engaged with the person to fully know what the answer is. So they've communicated that they're unwell, but you haven't closed the absence off for a very specific reason, or you realise it could change, so they might give you one reason initially. So what we often find is when the absence is closed, that the reason will be populated. So that used to be really high. That's much, much lower than it was, but it's essentially missing data. In terms of the port, the port have done some really, really proactive work, and in previous reports their attendance levels had improved quite significantly, but they are quite small, so it only takes a few isolated cases, and if you look at the reasons, psychological stress, that's gone down there, but the viruses have gone up significantly, so it's likely to be the time of year for them because they're out, a lot of them are outside, and it's a quite open environment, yeah. And then the other reasons will be down to very specific, a couple of individuals who have been absent for a period of time, so we would hope to see that come off. It's just the smaller the directorate, the bigger the impact when you have a couple of long-term sickness cases. But they are very, very proactive with their health and safety and very proactive with managing attendance over there. So I would anticipate that being a blip and not the norm. It's not through lack of engagement with that service working with us. They work with us very closely. Was there another question? Sorry. Oh, the staff feedback. Yeah, so we have around 80 wellbeing champions across the organisation. So the hope and the expectation is that they're working with their services to bring ideas, which someone in my team facilitates a session with them. So there's an opportunity for shared learning there and bringing information and intelligence back to us. And we're also in the middle of the staff survey, which again should give us a whole host of information. So what we tend to do once we have the staff survey results is triangulate all of our data sets. So what's our absence data telling us? What's our intel from all of our working groups telling us? So not just the wellbeing champions, but all of the networking groups we've got around the council. What's the staff survey telling us? And then bring it all together and kind of try and bring some data sets from that. So yes, I would hope that there are lots of opportunities, and we also have monthly informal meetings with our trade union colleagues who are not backwards and coming forwards and telling us what we should be doing, how we should be doing it, and improvements we can make. and we also, is it bi-monthly formal meetings with them now? It was quarterly, wasn't it, Joseph? Have we, yeah, so I think it's bi-monthly, more formalised meetings. So we don't resolve matters with the trade unions locally monthly, which we ordinarily do. We have a formal meeting that's minuted for them to bring suggestions and get a formal response to those. So I'm hoping between all of those channels that we're giving staff enough opportunity. What we tend to find is when we go out to do the wellbeing checks, we don't just go out to do the wellbeing checks, we'll have a reason. So it might be that we're launching something on VivUp and we know that the non-computer users will find it trickier to engage. So we'll go out for the wellbeing checks to tell them what's going on, to check in with health and safety. We'll also, our staff will have a chat with them and see what's going on, and they'll give us lots of insight as well into the services and what's happening, so we can bring that back.
Fantastic, thank you very much. Members, any further questions? Councillor Ashmore?
If I may, I noticed you mentioned about there's a staff survey and stuff like that, because I was going to ask, because you've got the employee assistance programme and the self-help stuff that's clearly being used and appreciated. I just wondered if there was any way that there was feedback on that to prove, you know, to see how it worked for the members of staff, or, you know, how they think maybe it could be improved, maybe. Or does the staff survey cover that as well?
Yeah, it's a tricky one because it's all anonymised in terms of people are able to access it in their own time. So we've got the data hits. We do get regular feedback about the online GP services because whilst we won't know who's accessed it, we will know the reason why people have accessed it and the accessibility. So we can sort of contract manage from that perspective. I think it would be the more staff survey route, because that's the forum for us to, it's truly anonymised, it's a safe space to give that evidence, whereas if you're the one contacting the GP, you probably don't want to give that feedback. But having said that, I've got staff in my own service who will access these services, and they will tell me if it's easy to access, not easy to access, or if we need to change things. And we encourage the trade unions to be the voice as well. So anything new we're launching, we'll ask them to engage within the testing phase to give us that feedback as well. So from a contract side, it's more procurement based. The staff survey is more the humanistic space, I guess, is the easiest way to summarise.
Yeah, that's really good to hear. And yeah, as you say, it's only right that it should be anonymised like that, but it's good to see that there's some link back there for continuous improvement. Thank you.
Members, any further questions? In which case, we have 5 recommendations to note. I'm not going to read them all out. Members, are recommendations 1, 2, 3, 4 and 5 so noted? Agreed? Wonderful, thank you very much. And for item 5, it is back to Rochelle again for the Trade Union Facilities Time report.
Thank you. Hopefully this one will be quicker. So those of you again who have been here, this is a statutory report that we're required to publish annually. This report complies with the Trade Union Facility Time publication requirements. Those regulations were introduced in 2017, and it mandates all public sector employers to publish annual data on facilities time, which refers to paid time off for trade union duties. So that's our staff who are participating in trade union activities, as well as our funded trade union officials. There's not any significant changes from the last reporting period to significantly draw your attention to. People are often quite interested in the cost. So in terms of the percentage of the pay bill in this report, it's 0.069% of the pay bill compared to last year's report, which was 0.04, so a slight increase. You'll see in the report that we include a table as to where we are in line with our peers. That's based on all of last year's data, because we don't have this year's data because nobody's been required to publish their reports, so they won't publish their reports until they have to. But as soon as we get that data, obviously we can let members know where we sit in that table with that slight increase. In terms of other points to note, we've had an increase in FTE union officials from the last reporting period, which was 10.72, to this time, which is 13.24. So this is in FTE, but that's essentially we have 14 staff working on trade union activities. We've continued to see an increase since the pandemic, and I think that's because of the collaborative working we were able to demonstrate during that period of time and the benefits it brings to the organisation. And the schools remain in the same position in terms of the reimbursement arrangements. So no significant points to note unless there are any specific questions.
Thank you. Members, any questions? Councillor Strada.
It's less of a question and more of just a comment. I really liked the sort of summary in section 5.3 on page, oh, it's hard to see, 30 I think it is, where it just talks about, you know, that the council very much sees having, you know, maybe a higher amount of expenditure in this area because it means that there is a more collaborative approach between the council and the trade unions, and that's obviously had positive outcomes. And yeah, I just would really like to support that and echo that. And I did check in with trade union colleagues, and there's just, you know, nothing to raise because, you know, things are working really positively. So that's really good. So thank you.
Very encouraging to get that feedback directly from the trade unions as well, outside of the formal minuted meetings. Councillor Candlish, were you going to come in?
Well, it's kind of... So firstly, I would also like to commend that table because it's a really good way of doing some quick comparisons to other places, and coming into the committee new, it's obviously quite hard to know what numbers are meaningful and how they go. It is interesting to see that in the last year report that actually the number was about a quarter of other people and percentage of pay spent on it, and even at the 0.69 it will still be substantially below other areas, yet we're also saying that we've got, you know, pretty decent working relations going with it. So that was just my observation. I was going to ask the question, kind of why?
I think it will...
Or how, actually, maybe that's a better question.
Yeah, I think a lot of it comes down to membership, in terms of some of the councils listed will have significantly higher trade union membership than we see as an organisation. And whilst we can't be specifically clear on the percentage of staff who are in a trade union because it's not necessarily through our payroll, we know has levelled out at around 9–10%. You may see that significantly higher in areas like Brighton and Hove, for example. So I think it's reflective, and we've got the positive relationships, we've got the governance arrangements in place, and Portsmouth are unique in working miracles with not much resource. That's just what we do. But it will depend on the resources.
Yeah, and I think the only thing I would add is that we've worked very hard over the last few years to develop more of a partnership working approach, which means that we can achieve a lot more with less, because the culture and the relationships are there that we've worked hard to develop over that period of time. And I think I would never describe the pandemic as a positive thing, but a positive thing that came out of it was actually some really positive working relationships with the unions that we've been able to maintain going forward, and taking some really pragmatic decisions and to deliver some significant change across the years since then.
Thank you both very much. Members, any further questions or comments or observations on this report? No, in which case we have two recommendations to approve, that we note the data from Appendix 1 and the fact that it will be published on the Council website and the Government Maintained website, and Recommendation 2, that the data will be included in any relevant annual report and accounts published by the Council. Members, are those both agreed? Lovely, thank you very much. Final item of the formal agenda then, over to Natasha. We have to appoint a councillor to serve as the substitute member on the Hampshire Pensions Fund panel and board for the 25-26 municipal year.
Thank you, Chair. There is no report accompanying this, simply a recommendation. We are required to make an appointment to the Hampshire Pension Fund of a substitute member. That has been discussed with group leaders, and it is proposed to this committee that Councillor Judith Smythe is recommended to be that substitute member. So over to you.
And I think for full clarity, it's worth noting that Councillor Smythe has served in this capacity previously, and nobody else put themselves forward. So,
correct.
Members, any questions, comments or observations, or are we happy to appoint Councillor Smythe? Any opposed? I see none. Wonderful. Councillor Smythe is so nominated. Thank you very much. That brings us to the end of the formal agenda. If members could just hang around for a couple of minutes.